When you have an emergency and that big red fire truck shows up, it's a relief to know that advanced medical care is on its way. This spring, the Midland Fire Department added Emergency Medical Technician, or EMT, to the list of life-saving services it provides whenever you make that call. Fire Chief Leonardo Garcia says the EMT status provides a much more enhanced service for the $5,500 investment in training and equipment it took the department.
As an EMT responder, we can apply more advanced skills that we learned in the EMT coursework, and also we receive more background knowledge in medical conditions. So it is an improved service that we're providing. But when we don't have fires, we like to do something for the community as well.
The Midland Fire Department responds to an average of 4,000 emergency runs every year. In 2008 alone, more than 3,000 of those runs were medical calls.
We have 3 stations located throughout the community, and our data shows that we get on the scene first over 75% of the time and start treatment on medical incidents. Things are changing. We're seeing things like obesity, diabetes at younger ages, and then also there's some families that don't have medical insurance. So it makes sense to be able to provide a better service to meet those changing trends.
Just what does the fire department's EMT status mean to the citizens who need help?
Well, one of the biggest benefits to the city is the amount of training that EMTs receive before they even arrive here at the fire department. There's a lot more hours of training required to become an EMT as opposed to an MFR. Specifically on an accident scene, probably the traction splint is the biggest benefit. It allows us to mitigate a broken femur and reduce some of the injury that occurs with that. That can be a very traumatic injury. We also have what's called a combi tube. It's an advanced airway that can be placed in a victim and it requires less training to do, but works on just about every victim. We also have an EpiPen, which is actually epinephrine that we can, it's an auto-injector. We use that to relieve anaphylactic shock or an allergic reaction, a bee sting, things of that nature. And we can actually, it's kind of a stopgap measure until the paramedics can arrive and do more advanced measures. We also are able to now communicate directly with the hospital emergency room through the emergency radio network, and that allows us to have online medical advice and talk directly to the doctors.
To put the level of training into perspective, prior to 1991, the Midland Fire Department was limited to administering cardiopulmonary resuscitation and minor medical care at traffic accidents with injuries. In 1991, the department became a medical first responder, with MFRs taking about 60 hours of medical response training. Emergency Medical Technician, the department's current status, means firefighters receive 194 hours of medical training, which includes hands-on experience working in an ambulance. And paramedics take about 18 months worth of coursework.
The additional training that our members receive to be EMTs makes them much better equipped to deal with medical emergencies. It helps them with recognizing what's wrong with the patient. It also assists them in treating the patient.
The majority of the department's firefighters are EMT certified, and all new hires to the department will be required to possess an EMT training level. At least one EMT will arrive on every medical response made by the Midland Fire Department. And the Midland Fire Department is only one of 58 departments in the state of Michigan to provide EMT level service. Thanks for all you do to keep our community safe.